Our endocrine system has really powerful impacts on our ability to control muscle growth or atrophy. So we're going to be talking about that in this video. Fiber hypertrophy, which is the growth of the muscle fibers, so the individual cells going from small to large, that is going to be facilitated largely by testosterone. Testosterone is the most important anabolic hormone we have. It works synergistically with growth hormone, so the two together are going to promote more protein synthesis and more hypertrophy than either one by themselves. And they are going to be increased following resistance exercise in both men and women, although women do see less of it, so less of an increase, as well as less at baseline than men, and so do prepubescent boys. Some other hormones that are important here are growth hormone, as I already mentioned, insulin-like growth factor 1, IGF, which is IGF-1, insulin, and thyroid hormones. All of these are going to help promote muscle growth. These are not the full story, though, I should say. So the endocrine system is a major influencer on skeletal muscle growth, but there are subcellular processes involving things like mTOR that also affect the muscle growth, so they cannot be ignored, but this is focused on the endocrine system, so we're not going to talk about that here today. Reversing things here and talking about fiber atrophy, so the decrease in muscle fiber size, so going from large muscle fibers to small muscle fibers, that is going to be driven by cortisol primarily. Cortisol is a catabolic hormone. It's going to cause the breakdown of muscle proteins, and it's going to work in opposition to the testosterone. Interesting, it's going to be that balance of testosterone to cortisol. It's going to determine if you have atrophy or if you have hypertrophy. So if you have more testosterone binding than cortisol binding, it's going to essentially block the cortisone from binding in the DNA in the areas where it's going to promote atrophy. And so you're going to end up with hypertrophy. And if it's the opposite, if you have more cortisol binding than testosterone, you're going to get atrophy. The cortisol is important, though, to the process of remodeling the skeletal muscle, which is part of hypertrophy as well as atrophy, because it's going to help in the removal of the damaged proteins in the muscle following exercise. So both cortisol and testosterone are important to the process. You just want more testosterone than cortisol in order to boost muscle growth rather than having atrophy. The endocrine system is really powerful for its influence on the ability to grow muscle, but it is not the only factor affecting muscle growth. mTOR works with testosterone in order to increase muscle protein synthesis, but it also has independent factors, so independent of testosterone, that are going to affect mTOR's activity, and mTOR is ultimately what is going to control muscle growth.